Very good morning to everybody. First of all, I wish to offer the apology of Madam Minister, who is unable to be with us here this morning, and wish her good health. It is with great pleasure that I have the opportunity to welcome you here today for the important collaborative workshop on health reporting for improved health outcomes, which has been organized by the Ministry of Health and Medical Services in partnership with the World Health Organization. On that note, I would firstly like to sincerely acknowledge the presence of our distinguished guest, Dr. Corinne Capuano, World Health Organization Director of Pacific Technical Support and representative of the South Pacific, Mr. Christian Leitmeyer, who World Health Organization Headquarters Communications Officer. Thank you, sir, for traveling all the way from Geneva to conduct this 2 days collaborative workshop. We welcome you and hope you will enjoy your brief stay here with us. I would also like to welcome my colleagues from the Ministry of Health and Medical Services, and finally, and most importantly, our colleagues from the media. Ladies and gentlemen, I would firstly like to state how very important this workshop is and how this is something that I have been sincerely looking forward to in terms of engaging the media organizations on health reporting for improved health outcomes. And that's so because each one of us have the capacity to improve health outcomes for our communities. Whether that is a medical doctor, nurse, or as the media, who plays such a critical role in building awareness and mobilizing individuals and communities to protect their health. Health communications is not purely about providing information about health issues. It plays a far greater role in ensuring that communities are equipped with the knowledge and information about health issues to take action to improve and take responsibilities of their health. And the media plays such a crucial role as key champions for change in health behaviors and as the early warnings system for health emergencies. During an emergency outbreak, we rely so heavily on the media partners to provide critical health information to affected communities. These new reports can mean life and death for our communities, and as such, this is something that we need to get right. This is why it is so crucial and critical that we get information out to our communities in ensuring accuracy and timeliness, and in a way that gives them practical, clear information about how they can protect themselves. The difficulty here is translating complex medical information into something that the community can understand. And I'd like to iterate here is the meningococcal that's been hard to come by at times when people ask you the question. It's hard to pronounce. The difficulty, given the potential for medical reporting to have powerful effects on the public, it's important that not only we as health authorities, but that the media is provided the opportunity to have a common understanding of the medical science so that this can help them translate information for the community's consumption in a timely and responsible manner. This is why I am so excited to have you all here today, because this is an opportunity for the ministry to provide you key information about health issues, as well as for us to learn from your experiences as media practitioners about how we can better support you to communicate to our communities about health information that is clear and understandable. Media holds the power to ensure that our general public is provided with the latest, accurate, and timely information to enable right actions to be taken by the families in ensuring their health and welfare. This remains a challenge on few occasions. We have appealed for factual reporting by the media, as any irresponsible reporting to that effect will result in unnecessary panic among the public That is why it is important to base media reports on facts verified by the health authorities. As you know, we have recently had an outbreak of meningococcal disease. This is a serious issue that the ministry is seeking to address with our partners, including World Health Organization. However, a key priority for this, getting the community to understand what meningococcal disease is, to know the signs and symptoms, and to be alert for them and report early to the health facilities. In this case, we are conscious that we do not want to raise alarm and anxiety in the community, as we know this is still an uncommon disease. That is why it is important that making sure that information is presented in the way it is empowering but does not cause confusion and misunderstanding is critical. I believe that through today's workshop, we can learn how we can better communicate about issues such as this, so that the communities and the Fijian families are able to get the information they need in a timely and transparent manner. On the other side, though, it is also a challenge for us to engage our communities on important health issues, such as health eating, exercise, and non-communicable diseases. This is because these health issues are sometimes products of common social behaviors, such as eating certain foods or lack of exercise. Changing behaviors is possibly the hardest thing to do, as it requires creating social change, and this does not occur overnight. In long-term, sustainable change in people behaviors. I am informed that a similar workshop will be held here tomorrow for the ministry's senior managers, thereby providing them with the opportunity to enhance their communication skills as health professionals in terms of intensifying reach out to communities. And we are indeed grateful to the World Health Organization for their tremendous support and leadership, for without whom we would not have been able to organize this wonderful and much needed workshop for Fiji. Indeed, we are grateful to World Health Organization for funding the workshop and getting a highly qualified communication expert like Mr. Christian Leinmeier, who comes with a wealth of knowledge and experience on health communication skills to share with our media organizations and our senior managers. On that note, I would like to also acknowledge the efforts of the ministry's media team, who have worked closely with World Health Organization in organizing the logistics and programs for this very unique two-day workshop. Indeed, this event here today reflects our strong partnership and commitment to work collaboratively with a prestigious organization such as World Health Organization in our efforts to empower Fiji's media organizations to strengthen their knowledge and partnership to improve health reporting for enhanced health outcomes. With that, I am confident that through this networking, we can share and learn from each other's experiences on how we can help improve health outcomes for our communities through strategic health communications. We encourage all our media partners to maximize on this opportunity, as it is a very interactive session to learn and share ideas on how together we can, and as a nation, can enhance health reporting to develop the health and livelihood of our Fijian families. I wish you all the very best for the 2 days health reporting and media spokespersons workshop. Good night.